Aloha and welcome to the Kupuna Connections television program. I'm Cullen Hayashida, the host for this show. And as you know, on a weekly basis, we have broadcasts having to do with family caregiver training and family caregiver issues, as well as issues that are important to our active retirees as well. Today we have a chance to talk about the Elderly Affairs Division of the City and County of Honolulu and the services that they provide. But before we get started, I thought we start by introducing our guests, and I thought we could start with my right here with Carol. Perhaps you can start out by introducing yourself and who you are and what you do.
Thank you, Cullen. Aloha, everyone. My name is Carol Mukainai. I am the Information and Assistance Coordinator for the Elderly Affairs Division. I've worked with EAD for more than 3 years.
Yes.
And I pretty much supervise the INA unit, which is the Information Assistance Unit. I have approximately 10 people who provide services for seniors.
Okay, and we've got Pablo here,
yes.
right?
Again, Colin, thank you for having us here. My name is Pablo Veneziano. I'm the caregiver specialist with the city, and I've been with EAD for at least 3.5 years, and looking forward to share some of the information.
So both of you are associated with information and assistance.
Yes.
Okay, and I guess this is the focus of what we want to talk about today. Now, Elderly Affairs Division, of course, most people, when you say Elderly Affairs Division, may not be too familiar with that. We say maybe the County Office on Aging, that maybe rings a little clearer bell. But tell us a little bit about what is Elderly Affairs Division? What does it do?
So the Elderly Affairs Division in 1973 was designated as the AAA or Area Agency on Aging, and it's under the Department of Community Service for the City and County of Honolulu. So basically what EAD does is, and the INA unit, what we do is provide services for our seniors 60 and over, and the types of services we provide are bathing, meals, transportation services. We do have community service outreach workers who conduct phone intakes and then schedule an appointment to also develop an ADRC support plan with the seniors.
Now, sometimes I hear about INR. What's INR?
So INR, originally the Elderly Affairs Division was called Information and Referral. And 5 years ago, the INA coordinator back then, Lei Shimizu, decided to change it to Information and Assistance, because there was a shift in the way they provided services. So 5 years ago and further back, what the community service outreach workers did originally was to go door to door and provide brochures and information. But 5 years ago, they shifted to direct client services and actually providing the intakes, the assessments, and then through contracted services and grants management, we provide those types of services to our seniors.
I see.
Yeah, and so through these INA services, the general public can call us at 768-7700, which is the senior helpline, to initiate the information and assistance services.
I see. Okay. Now, once in a while you hear the term ADRC, Aging and Disability Resource Center. Is that the same thing as Elderly Affairs Division?
Well, we are sponsoring the ADRC, which is the Age and Disability Resource Center. It's also called the No Wrong Door. And so it's actually gathering it's a new type of system of gathering information from seniors. It may be quite lengthy. The phone intake is approximately 15 to 20 minutes long. And when the CSAs or community service aides schedule a home visit, the ADRC support plan may take up to 2 hours.
I see.
It's just collecting additional information.
Yes,
assessing their needs.
And deciding what kind of...
And deciding there are trigger questions in the ADRC that can trigger whether or not the senior would need immediate services.
I see.
So, for example, a question may say, where do you live alone, with a partner, with your spouse? Those types of questions. And if they say no to that question and some other questions, it may trigger the senior to be in need of, like, say, telephone assurance, reassurance.
Oh, I see.
Because it's like they're isolated.
I see.
Or they're frail, or they lack informal or formal support systems.
Yeah. I see. So these are services that you folks provide.
Yes.
Well, it's an approach.
Yeah, it's an approach.
To try and connect with the seniors or a caregiver.
I see.
So with the, people who's not familiar with internet, this calling of the senior helpline is another possibility of providing access to information. So Carrot had expanded on the assessment aspect to try and get into our services or qualify for our services. The other simpler matter is just getting general information to assist the caller, whether it be looking for a resource number, from housing to meals to what other private pay type of services are possible.
I see.
So there's a difference between the type of services we offer, which is free, but again, it's limited fund.
I see.
So
I see.
depending on the caller's so-called other resources,
I see.
and the
You
wellness
try
of
to
their
combine
planning.
those two.
Yeah.
Right.
Okay. Now, one of the slides that we have up now is a picture of the Senior Information Handbook, Assistance Handbook.
Correct.
Tell us about this.
Okay, so the Senior Information Assistance Handbook, you can, we provide that handbook at American Savings Bank, at satellite city halls. This handbook has information about facilities, assisted living facilities, nursing homes, care homes, meals, legal assistance, all types of different assistance that the seniors may.
I see. Okay. So this is a really good resource guide for our older adults and for the families.
Absolutely.
Yes.
And it's free.
Absolutely.
And this particular version was just published.
So it's pretty up to date then. As that
I
sense.
guess if you could look for it at the senior fair.
Yes.
Okay, which is usually around September.
September 25th through
September.
That's 27th.
Usually
so there's going to have a lot there.
I see.
Available for the general public.
Yeah, and so.
So I just want to say that we no longer have those senior handbooks in our office. So the only other place you would receive those senior handbooks are in at American Savings Bank, Satellite City Hall, or
You don't
not in
retain.
our office.
It's a hot commodity.
It's a very hot commodity.
Yeah.
Yeah. Sorry.
We should have paid for advertising to get it more
Really?
published,
Really?
but that's a different
So
concept.
what are some of the most requested phone numbers or places would you say in here? Is there anything that comes to your mind?
Housing.
Housing.
We've had many seniors calling us, either being evicted from their homes, they're already homeless, or they're just wanting to move into some type of facility.
Yeah.
But housing is one of the major reasons why seniors call, and their adult children call, as well as bathing, meals, transportation.
Yeah, and I think the things on the rise too with caregivers is probably like the abuse
Right.
against seniors, the scams, and
Right.
and the financial,
Right.
I guess, mishaps that can happen between families and their estates or their so-called assets, and you know, just the daily financial management. So
Okay.
it's the abuse of seniors.
I
Right.
see. Okay.
Right.
Okay. You use the word seniors. What is a senior?
Well, again, for our specific program,
Okay.
you know, we want to make sure it's operationalized.
Okay.
So our definition is dealing with someone who is a U.S. citizen.
U.S. citizen. Okay.
You know, I think living on Oahu.
Okay,
You know, I think
right.
we receive calls trying to help others from different counties.
Yes.
And it's a heartbreak to just quantify that we're trying to deal with people living on Oahu.
On this island.
Yeah,
Right.
and again, it's limited services, yeah,
Right.
amount of funding too. So a person who's 60 years old, depending on the type of funding, we're looking at the impairments of their daily living activities as well as their instrumental daily living activities.
Those are the
ADLs and IDLs.
Those are things important when you want to provide service. But as
Correct.
far as
Right.
who is a senior, as far as this Elderly Affairs Division is
Correct.
concerned, is 60 plus. Then.
60 plus.
60 plus.
Okay.
Right.
And then hopefully not residing in an institution, foster
Right.
care,
I see.
on adult residential
I see.
care.
I
Low
see.
And-
income.
I see. That's how you kind of judge what is an eligible group that you
Correct.
can really
Right.
And
serve.
then I want the other point would be, I think, no duplication of
Right.
any governmental
And
services.
that makes sense. right,
because
yeah.
of, again, limited
Yeah,
resources
yeah.
that we want to make sure we
Yeah.
can provide and not, you know.
Well, it's, you know, I raise that question because, you know, something when you look at Social Security, they use a different age for
Correct.
what is a senior,
Right.
you know.
yeah. Housing. you know,
Housing, you might
Right.
use something
or
else, yeah.
the affiliation to the different
Volunteers.
groups.
Yeah,
Right.
but for the County Office on Aging, it's 60.
60.
Why is it 60?
It's according to our funding.
Federal
Federal
requirement.
guidelines.
Federal
Federal
guideline
guidelines.
enforced by
Right.
State
Okay.
Office of
You're right.
Executive Aging.
Right.
I see. Okay, okay,
Right.
So,
okay.
and that's
So,
so that we can utilize those funds
Yeah.
properly.
See, a lot of times people say, well, you know, I'm 65, but I don't feel like a senior,
Correct.
you know?
Exactly.
Right.
Exactly. Correct.
Yeah.
Correct.
Still got a
And
lot of
it's-
gas in my tank.
Right. It's just it's just for us to identify how we can help a senior. So
Right.
we use that number 60.
Right,
But
right, okay.
Actually, the state and the federal
Right.
government does.
Okay, okay.
Yeah.
Now, let's kind of shift gear a little bit and share some things about some of your INR services or INA services. And we have some pictures that
Sure.
perhaps you can share with us. But perhaps you can tell us a little bit about some of these different kinds of services that you folks provide. And so here we have some pictures here. Maybe you can kind of share with us what this is about.
So here, the volunteers. and
Volunteering services.
Volunteer services through
Okay.
the Retired Senior Volunteer Program, the
Okay.
RSVP program, which is also housed with EAD.
Okay.
And these volunteers are preparing bags, toiletries for
Okay.
seniors
Okay.
for Martin Luther King Day.
Oh, okay.
You're right.
So there's an opportunity for older adults that don't know what to do with themselves to actually come out and
Correct.
help the community.
Well,
yeah?
for the RSVP program, their volunteers can be 55 and over.
Okay, so that's slightly different
Yes.
definition of
Right,
senior then.
Right. And
Okay.
so some of the donations are actually, we have this wonderful staff, and her name is Remy, and she and Robin contacted different agencies on the island, and they donated over 500 toiletry items. It
Really?
was fabulous. It was unbelievable.
Fantastic.
Yes.
Let's look at this next picture here. What's going on here?
So this is one of the RSVP volunteers delivering a Christmas gift to one of the seniors in the community. And the way we receive the names of the seniors is through our community service aides. Since they work, in the community, assessing the seniors,
Yeah.
they provide the names to the RSVP program. And of course, it's all based on, income,
Right.
isolation,
Right.
frail, those
Yeah.
kind
So
of
this
things.
is some Christmas gifts.
It's Christmas gifts, yeah. Because
I see.
during Christmas, we also have homestead,
Home instead.
right, program that also donates
I
Christmas
see.
bags to for our seniors.
Oh,
And
okay.
the process is the same.
I see.
Through our CSAs, they provide us the names.
And then the next picture that we have here, what is this?
This is the former RSVP director,
Okay.
Janelle, and she is actually conducting an orientation for volunteers.
Oh, training the volunteers.
Yes,
Okay.
yes.
Okay. Oh, wonderful.
So this program
okay.
is fabulous.
So people don't have to sort of just walk in and be a volunteer without any experience. They're actually getting some orientation, yeah?
Correct.
Which gives them a sense of comfort too, that they're
Right.
knowing they're doing the right way.
Yes.
Yeah.
Correct. Yes.
Okay. How about the next picture here?
Okay, so this is one of the RSVP volunteers. She's in the community garden.
Uh-huh.
I believe it's at one of the schools because that's one of the RSVP station.
Oh.
So this is where they volunteer at schools, at museums, where they volunteer in a number of places.
I
So
see.
They're very active seniors.
I see. Okay. Okay. And this next picture here?
This
What is that
picture
anyway?
is a
Playhouse?
little playhouse. Yeah, there's a little playhouse at a school.
Uh-huh.
I can't say which school it is, but yeah, they're helping the school actually to build and repaint and build and paint the little, I guess.
So
house.
are these volunteers that came out of the Office on Aging, or?
No, the RSVP program actually recruits for their volunteers at the senior health fair, which is the Good Life Expo. Different presentations. They invite themselves to present at organizations, unions, schools, wherever they can. You know, but they're very productive when they recruit. They're up to over
okay.
more than.
What about all
200.
that material to put the playhouse
So a lot
together?
of it is either donated by
Nonprofits or what?
nonprofits, or the seniors donate them themselves.
I see. And so this is at a school?
It's at a school.
Oh,
It's at
wonderful,
elementary
wonderful.
school.
Yeah, terrific. It's giving back to the community,
Yes, yes.
yeah? Yeah. And then this next slide here, picture?
It's during one of the senior recognition programs, and these are lovely seniors,
Yeah,
active seniors, I want to say, dancing hula.
yeah.
And I believe they may have come out of the senior centers, one of the senior centers, either Mo'iliili or Lanakila.
I see. Okay. All this is all, you know, these volunteer activities and this dancing is both exercise as well as being part of a group. So it's
Absolutely.
all active aging. Yeah.
Absolutely, and it gives them, the seniors, the opportunity to socialize.
Yeah.
You know.
Yeah, and then with hula too, you know, you're picking up values too,
Oh,
right?
yes,
Yeah.
absolutely.
So there's all kinds of
Right.
benefits, yeah.
Right.
Even for your health too. yeah?
Yes. Yes.
Yeah.
Yes. Yes.
So now we have another slide here that lists down, I believe, all these different agencies.
Right.
Well, what are they now?
So we have Mo'iliili Community Senior Center, where seniors, where the center provides a lot of activities for the seniors, and I can't see the next one. I'm sorry.
That's elder law program.
Elder Law Program
Yeah.
provides, like if the senior needs assistance with the living will, advance
I see.
directives,
as well as caregivers,
as well as
in a more
caregivers.
cost-effective way.
Right.
Cost-effective way.
With
Right.
centering legal issues.
I see.
Right.
So
Right.
these are all the different nonprofits that work with the Elderly
Right, with
Affairs
Elderly
Division
Affairs
under
Division.
contract and providing services.
Correct. And we do have a new provider. I want to address them as well as Keiki Kupuna
Uh-huh.
and their new meal service, and they provide
A meal service?
right, home delivered meal service, and they deliver services from I want to say from Waipahu to Waianae
Oh.
on the Leeward Coast.
Oh, okay, okay.
Yeah.
Yeah,
So they're one of our new service
Yeah,
providers.
so-
And we do have, I don't want to miss them, Lanakila Community Senior Center as well.
yeah, Lanakila Meals on Wheels
Yes,
is listed,
yes,
Kokokali Valley,
Yes.
Hawaii Meals on Wheels,
Yes.
Hawaii Family Service. What is Hawaii Family Service
Hawaii
about?
Family, so you want to,
Well, yeah,
Address
that particular contract or service deals with grandparents taking care of grandchildren.
Oh,
So
okay.
as a caregiver,
right.
and through this service provider, Hawaii Family Services, they provide support groups and training for these grandparents to care for their
I
grandchildren.
see, I see,
So,
I see.
Um,
Yes. Then you got
out in
Child
the-
and Family and, yeah, Alzheimer's Association. So it's just a broad array of different
it's
agencies.
a broad array. Alzheimer's Association, you know, they have support groups for caregivers or who
Yeah.
are parent are experiencing Alzheimer's.
Yeah,
And
yeah.
Project Donna, they provide attendant care, home safety, as well as caregiver support group.
and
Right.
then you got St. Francis Health Services there for bathing services.
Bathing
That's,
services.
again,
Yes.
critical. to
That's
try
been
and
long
maintain.
standing, yeah?
Yes,
A long
they've
time,
been-
yeah? They've
yes,
been doing good
yes,
stuff.
yes.
And then the next slide that we have here, I guess, is all these different services are some maybe a little bit difficult to read.
So personal care would be bathing services.
Yeah. Then you got
Then you have homemaker
homemaker.
chore.
Mhm.
Those are homemaker are services that seniors need heavy housework.
Mm-hmm.
You know, so cleaning the windows, moving the furniture, and things like that.
Mhm.
And
Or hoarding, right? Hoarding
and hoarding issues.
Hoarding, yeah.
issues
Yeah.
with
Right,
certain
right.
Removing the
seniors.
clutter, yeah?
Yeah.
Yes, yes,
Yeah.
yes.
Yeah.
The congregated meals, again, just to kind of give some detail of what it is. So through the Lanakila Meals on Wheels program, they have several sites
Mm-hmm.
throughout Oahu where the seniors can actually go to those particular sites, and
Mhm.
it's to kind of encourage social and recreational
Yeah.
and a meal more
Right.
so to get
Not
them
just a
out of
meal,
their
but a
house.
chance to actually get out of the
Engage
house,
in-
right?
yes.
Get
Exactly.
dressed, put on your
Right.
makeup,
Correct.
and get
Right.
out, yeah.
Yes.
Right.
And that's it. That's
And-
important.
That is
Um,
very important.
yeah.
It is
And then,
very
like
important.
again, assisted transportation. That also has two types: medical and non-medical.
I see.
So so depending what type of funds would
Yeah.
be used,
Yeah.
and through the
Yeah.
assessment, that's going to
Yeah.
pinpoint which funds to use.
So I guess with this, you just see just an array of different kinds of ways that Elderly Affairs Division is helping the community, and of course, oftentimes it's not possible to do it all by yourself, and so you work with other nonprofits to actually
Correct.
reach out to the
Correct.
community. Yeah?
Correct.
That's wonderful. Let's talk briefly about caregivers.
Okay.
Yeah? And what do we mean by this?
Well, I guess in its simplest term, it could be an adult family member or individual who helps older individual or senior, and it's usually unpaid, and I guess these people are more so have a big heart. Probably they're unprepared as caregiving issues become more critical, and they sometimes overlook the how stressful it can get. So part of our services is to try to prevent burnout and to provide problem-solving skills. So
You train families?
well, again, through a provider such as Alzheimer's Association, what was that
Project-
Child and Family Service,
Child
Project
and Family.
Donna.
Project Donna.
Project Donna. I see.
And it's in a way too, it's providing some respect
Correct.
for the
Uh-huh.
caregiver to
Correct.
try to just
Just
free
be-
themselves of caring for
Correct.
Yeah.
their loved ones,
Yeah.
and then to kind of regain their personal time,
Right,
and making sure that they can maintain the caregiving to the care recipient. Yeah.
No,
So-
I know. I've seen people that are under so much stress, they get physically sick. Yeah,
Right.
Correct.
you know.
Correct.
So you want to, if we are going to somehow be able to have them continue to provide that role, they need to have a break.
Correct.
They
And
need
that-
to have a break.
Yeah.
Break.
They need to, yes.
And probably have a plan more so because
Exactly.
they're the ones that we're properly relying
Yeah.
on to kind of care for the
Yeah.
senior. Yeah.
Right.
Okay. Well, I think we're just about out of time right now. So, what I guess I'd like to suggest is if and we covered a lot of
Oh, yeah.
materials and shared a lot of information about what you folks do. One last tip for our viewers. What would you suggest?
I would say staying physically and mentally active.
Okay.
Stay informed
Stay informed.
on new trends, and change. That would change the effect of older adults, and I guess if you do that, you can age smart.
Okay.
Yeah. For me, I guess.
What would you suggest?
It's knowing the number for the senior helpline, 768-7700.
One more time.
768-7700.
768-7700. So viewers out there, I hope you can write that down. 768
7700.
7700, and I think that's a very important number for our community
Correct,
to know.
and to get started.
To get started, yeah.
In terms of
so
this aging.
just
smart.
know that we've got a resource with our County Office on Aging, and that they are there to provide assistance, and if you need help, call that number, 768-7700. So this is about all the time that we have. Thank you again for joining us on Kupuna Connections TV series. Aloha, and see you again next week.